How many of us are here to change the world? Me too. As students, we read a lot of theory, we study a lot of frameworks, we study a lot of theory. But you are right. We are here to change the world. The first time I thought about this in a real way was in the summer of 2008 when I went to India for a healthcare pilot program. During that trip, I met a 14-year-old boy named Ram in the villages of Rajasthan. He was a scrawny boy who had thick black hair and came up to about my shoulder. He told me his greatest wish was to go to college, if only he could regain the use of his right hand. As I looked, his hand lay at his side, burned and blackened. I found out Ram's hand was completely unusable due to a cooking accident when he was 4. As bad as the burn itself was, what angered me the most is that he, like every rural family, has burn ointment given to them by the government, and doctors are supposed to be readily available. And he's not the only one whose relatively simple injury turned into something life-altering. About 15% of all minor injuries in India result in preventable disabilities. That scrawny boy was why I was inspired. This is why I knew something needed to be done. After that summer, I started a nonprofit called Mobilizing Health to connect rural patients to their local doctors. And around the same time, for-profit companies were implementing a concept called gamification to incentivize their customers to purchase more products. But what if this concept could be used for the social sector? Social gamification changed the way Mobilizing Health impacted the lives we work for. And maybe it can also serve as a tool in your toolbox. Games. We grew up with games. Scrabble, Nintendo 64, Oregon Trail, Dungeons and Dragons? Anyone? Thought so. The term gamification was coined back in 2002, and it means inspiring action by incentivizing behaviors. Just like a game rewards you with the satisfaction of winning. Gamification really hit its peak in 2010, the year that Angry Birds had its first 12 million downloads. Angry Birds was one of the first times everyone, I mean everyone, from toddlers to moms to grandparents, were addicted. And everyone kept wondering, well, what was it? Turns out the makers of the game, Zynga, did 3 simple things. They just did it extremely well. The 3 simple things to gamify something is to set the goal, show the progress, give the reward. 1, set the goal, one that is valuable, interesting, and possible. Angry Birds' goal? Knock down all the pigs. 2, show the progress so that your player knows exactly how their action gets them towards their goal. In Angry Birds, once you knock down 1 pig, you know you have 2 to go. And 3rd, give rewards. In Angry Birds, you get points, you get to the next level, and you beat your last score. Again, that's set the goal, show the progress, give the reward. But what really brought home the dough for Angry Birds was its X factor. The thing that draws you in the first place and keeps you there. Angry Birds' X factor? It was actually their amazingly simple, vivid colors and characters. During his 2012 election, President Obama used gamification. He used Foursquare. Does anyone remember Foursquare? It was that app that allows you to check in and share online content with the goal of collecting more badges than your friends. This simple addition to his campaign increased his web traffic by millions of clicks. And of course, he was reelected. There are other examples of social gamification. There's a video game to motivate cancer kids to take their medications, a rewards app to motivate parolees to show up to their appointments. But as aspiring public servants, we don't need the programming skills to build an entire video game or have the budget of Obama's campaign team to have an impact. I realized the power of social gamification in 2010, when I seriously needed to figure out if my nonprofit's model just wasn't working. The mission of my nonprofit, Mobilizing Health, was to connect rural patients to their local doctors to increase access to healthcare. Here's how it worked. A patient in the village will contact our trained village leader, who would send a text message to our system, and we would forward it to our network of doctors. And our doctors would reply back, only 2 hours later, if they wanted to. This was a big problem. The doctors in our network were just not responding. Only half of our texts ever got responses, and if they did, it would be hours before a patient got an answer. For the next year, our team was trying to figure out what can we do? And I was starting to have doubts. But then, one day, I paid attention to Zynga and the craze Angry Birds was causing. And it hit me like a bird flying into a pig. For all my MLD compatriots, this was a classic motivation problem. How do you motivate doctors who would otherwise need a significant salary to be engaged? Gamify it. In the summer of 2011, we announced to our doctors that Mobilizing Health will be implementing its first doctor game. For every text message, they would earn points to get them to new levels. Every week, they would be sent an automated text with their progress. And once they reached a new level, they would earn a prize. Flowers, candy, something small. In other words, we 1, set the goal, earn as many points as possible by answering patients' texts. 2, we showed the progress. They knew exactly how many points left to get to the next level. And 3, we gave the rewards. Say we get a text message from the village with the patient's name, age, phone number, and primary complaint, like Ram's cooking burn. We would route this text message to our doctor's cell phones, and the first doctor to respond saying that they were available would get 1 point. The next text from the doctor, asking a follow-up question like, how long ago did it happen? Or giving a suggestion, immediately put on burn ointment and go see the village doctor right away. Got them 2 more points. The difference was stark. Instead of taking 3 slingshots to get a pig, gamification helped us nail the pig in 1. The very week we implemented the doctor game, our doctor response time was under 20 minutes. And it wasn't just an anomaly. Over the next few years, our doctor response time stabilized at 13 minutes and 40 seconds. And each text message would be responded to 97% of the time. It didn't matter if the prize was chocolates or candies or a name on a billboard. When we talked to our doctors, they told us that the change came from the mere fact that they were being appreciated. And maybe, just maybe, that affirmation was our X factor. Because sometimes the work is thankless, and we all want to be recognized. It took that one change for thousands of rural patients to finally get the medical advice they were seeking. So now what? The private sector has been using gamification for years. Loyalty points for purchases, getting on Nissan's online leaderboard for best drivers. Even celebrities and brands are using gamification to get you engaged. They have changed the game. Now is our opportunity to change our game. Because when you bring social gamification to improve healthcare, streamline government, close the achievement gap, and even strengthen infrastructure, you can change the world. Thank you.